I'd like to talk about the cyanamide therapy for patients with alcohol use disorder without insight into the disease. Later on, let me abbreviate alcohol use disorder as AUD. At first, before presenting my alternative method, I'll explain about cyanamide and standard method of cyanamide therapy. This is chemical structure of cyanamide. Cyanamide was originally agriculturally used as a fertilizer. Between the farmers handling the cyanamide, many are known to become intolerant of alcohol, so it has become medical use in the middle of the 20th century. Cyanamide is available as a water solution. This is 100 ml bottle. Top of the bottle is attached to 5 to 10 ml gauging cap. Cyanamide water solution contains 10 mg per milliliter. Should be preserved in the cold place. Alcohol ethanol is metabolized by two steps in human body. Ethanol is turned into aldehyde by alcohol dehydrogenase, and aldehyde is turned into acetic acid by aldehyde dehydrogenase. Alcohol makes us happy, feel free from anxiety, whereas aldehyde is a toxin and causes many adverse effects. Like disulfiram, cyanamide blocks the action of aldehyde dehydrogenase. This alcohol-cyanamide reaction increasing the aldehyde level and causes adverse effects. That way it becomes psychological break for craving. Cyanamide itself is a tasteless, odorless, transparent, almost like water, and very short half-life. In this point it is different from disulfiram. Disulfiram is long-acting, so accidental adverse reaction is less likely to occur in cyanamide compared with disulfiram. 50 to 200 mg, that is 5 to 20 milliliter of cyanamide is administered in the morning. Most patients with AUD drink alcohol from the morning, so it depends on the patient. If patients only drink at night, may be administered in the daytime or in the evening. To the full understanding of the adverse effects of the patient, drinking test is performed before prescribing cyanamide. In the hospital setting, patients will be administered 50 to 100 mg of cyanamide, and 1 hour after they intake alcohol very slowly, one drink in 30 minutes, until the mild adverse effects occur. This way cyanamide therapy is introduced. And now, from here about my alternative cyanamide therapy. Some patients with AUD has no insight into their disease, and some of them may say that I'd rather die early drinking alcohol than live long without it. This may seem relevant to their way of life, live happy life even if die early. But in many cases, things are not so simple. AUD patients have to live long being disordered, and the family members have a lot of trouble taking care of them, and the family members come to the psychiatrist asking for help. Cyanamide is contraindication for the patient who are not motivated because it has strong adverse effects with alcohol intake. But I thought there must be a way to use cyanamide by making the adverse effect as little as possible, but let the patient experiencing some adverse effect. To treat AUD patient without insight, I devised the cyanamide therapy program without their consent. That is, under therapist and the family member's decision, administer cyanamide without knowing of the patient. Of course, under usual dosage, this is a dangerous thing. So beginning from very low dosage and very gradually increasing the dosage. To do this maneuver, the help from the patient, reliable family member is needed. Later on, let me call this family member as key person. For that administration of cyanamide and surveillance of the patient, reliable key person's presence is must. To administer cyanamide, it will be mixed in the patient's drink or food. As the cyanamide is water-like solution, it will be mixed without revealing. Many Japanese eat miso soup in the morning. Some may not miso soup, may drink coffee or milk. The key person mixes the cyanamide in the miso soup or other drinks of the patient, unnoticed by the patient. Cyanamide administration starts from 5 mg daily. It is very small dosage, as usual dosage is 50 to 100, and gradually increasing weekly basis. At first 5 mg weekly, and from the 5th week, from the 20 mg, increase the dosage by 10 mg weekly, until the mild adverse effects will appear. The mild adverse effect depends on the patient's physical condition or the amount of alcohol taken. That sometimes fine-tuning is needed at this point. And once dosage is decided, continue that dosage until and if this maneuver works well, the patients are subjected to the negative effects conditioning and achieve the abstinence. It is hard to gauge the cyanamide amount to the level of 0.5 milliliter, 5 milligram. That is, but precise gauging is needed. So I gave a 1 milliliter syringe to the key person. Now let me show two succeeded cases. Case 1 is 75-year-old male, AUD plus mild Alzheimer and having angina. After retiring from work at 70, he gradually worsened drinking habit. At this stage, he began to cause trouble. He drinks 720 to 900 milliliters of sake every day from the morning. Sake contained 15% of alcohol. Although he is a good person in sober, under the influence of alcohol, violent behavior to his wife and nocturnal incontinence every day. This is the very person who said, "I'd rather die early drinking alcohol than live long without it." So his wife as a key person, this therapy started. At the point of 30 mg cyanamide administration, he revealed mild adverse effect, but still drinking heavily. I increased the dosage to 40 mg next week. This time a rather heavy adverse effect occurred. This time, so next day reduced to 30 mg. I said fine-tuning is sometimes needed. It's this kind of thing. In about a half a year, he gradually decreased the amount of alcohol intake, and frequency is also decreased. According to that, violent behavior and frequency of incontinence decreased, and his side activity like walking and gardening increased. He achieved abstinence in a year. At that time he said, "I got so old that I cannot drink anymore." Case 2 is 38-year-old female, depression plus AUD. Her alcohol intake is to ameliorate her depression, mood, and anxiety. Her first encounter with psychiatrists seemed unfavorable. She has distrust for psychiatrists and antidepressant, and strong reliance on alcohol. In Japan, shochu is available as a cheap liquor. That is 25% of alcohol, and 4,000 milliliter large bottle is especially very cheaply available. 4,000 milliliter for 2,000 yen. That is $18 or 15 euros. I call it as a AUD maker. She drink weekly basis wine this large bottle of shochu. That is about 600 milliliter daily, and gradually she could not function. She has her husband and a 15 years old son. Her husband persuaded her to stop drinking many times. Each time she said she would stop drinking, but drink again. At last her husband got angry and said to her to go to her parents' home because she is giving bad influence to her son. She began to live with her parents, and as her parents' home is near my clinic, her mother took her to my clinic, but she came only at the first time. So her mother, as a key person, started this therapy. In 2 months, although not yet achieved abstinence, she reduced drinking amount and frequency, regained function, returned to the original form. As her home is far away from my clinic, I handed over the therapy to another doctor who continued the therapy. Later on, I heard that she achieved abstinence and taking antidepressant. I have been doing this maneuver very carefully, so I had not experienced the trouble with the patients. But cyanamide is administered secretly to the patient without their consent, and using adverse effects as a therapeutic reason. I mean, in standard cyanamide therapy, patients are not supposed to drink alcohol, so it may have ethical problem to be criticized. And if the patient notices the medication and sues the doctor, it may cause some trouble. Dropped out cases are many, but they are not because of severe adverse effects, but because of the key person problem. They have to try not to be noticed by the patient that they are secretly giving medication. They have fear if the patient might notice the medication and also guilty feeling about it. And there would happen many stressing things. For example, patients may say, I feel something strange when I drink alcohol. In that situation, I gave the key person an advice to say that alcohol is giving them a bad influence gradually. And another example is, as the cyanamide bottle is usually preserved in the fridge, key person removes the label beforehand, but the patients may notice a strange bottle in the fridge. In that case, they reply that it is cosmetics or something. Glossing over this kind of things, telling lies, checking adverse effects, many of the key persons stressed out and gave up the therapy. So dropped out cases are many. But in some cases, if the therapy works well, the patient are subjected to the effects of negative conditioning and achieved abstinence. So I cannot say that this therapy has a statistically significant effect, but treatment of patients with AUD is challenging even if they are motivated to seek care. A motivated patient presents with even greater difficulties. So in that case, I think this therapy is worth trying.